This is the second half of Courtney Volker's and our Cochlear implant program, Rebecca Lewis. Unbelievably accomplished. She's a doctor of audiology. She's going to talk about the importance of hearing loss as we age.
Thank you. Thank you, Dr. Griffiths. I'm very fortunate to be a part of this team. I joined Pacific Neuroscience Institute just a few months ago, and I can already tell that this is a great home for me, and I'm very lucky to work with such talented physicians that we're hearing from today. So today I was tasked with talking to you about the importance of hearing loss as we age. I hope I can keep you awake after the food comas, and I know we've got our exciting keynote speakers right after this, so I'll try to do my best. So today I wanted to talk briefly about how prevalent hearing loss is, and I know Dr. Volker touched upon this as well. And so why is this so important? What are the effects of not treating hearing loss, and how can we help our patients by treating it and by getting them the right type of help? So just to touch base on the audiogram, or the chart of how we plot hearing on a graph, this audiogram, I know you all are familiar with audiograms, but this audiogram has speech sounds overlaid on top of it. So you can tell, where specific high-frequency consonants are in those softer, high-frequency areas versus vowel sounds that are a little bit louder in the lower pitches. So if we were to overlay this hearing loss on the audiogram, this patient would have a moderate to severe hearing loss and really no access to the everyday speech sounds. So if you can imagine for your patient, sorry about that. There we go. If you can imagine for your patients that have this degree of hearing loss, they are missing out on conversation. There's a great deal of auditory deprivation that's occurring, making it very difficult for people to communicate over time. Hearing loss is the third most prevalent chronic health condition in Americans after hypertension and arthritis. And with the demographic of 70-year-olds and older, half of them have a significant hearing loss. Oh, goodness. There we go. Hearing loss is one of the leading causes of disability worldwide, and it's rising significantly over the next several decades. Hearing loss is also related to our vascular health. The inner ear is extremely sensitive to changes in blood flow, so inadequate blood flow to the inner ear can actually contribute to greater degrees of hearing loss. Diabetics are twice as likely to have a significant hearing loss. And the same metabolic processes that occur in our inner ears actually occur in our kidneys as well. So individuals with chronic kidney disease are also really likely to have a significant hearing loss. As Dr. Volker mentioned, the patients 70 and older, very few of them are seeking treatment. So fewer than 30% of these patients are getting hearing aids, and in younger adults, the numbers are even poorer. Less than 16% have actually tried hearing aids. And when it comes to cochlear implants, basically 5 to 8% of patients who could benefit from a cochlear implant actually receive them. So this is a really major opportunity to reach patients. There's so many patients out there, so many ears to go around, and so many ways that we can help these people. So what are the effects of not treating hearing loss? As you imagine, quality of life. Even patients with just a mild to moderate hearing loss perceive their hearing loss as a severe handicap. Like Dr. Volker mentioned, loss of the ability to work, loss of independence, increased feelings of loneliness, isolation, depression, even suicidal ideation, especially after the last few isolating years of the pandemic. And this not only impacts the patient, this impacts their community, their family, their friends. While it isolates the individual, it also is affecting the people around them. Individuals with hearing loss also have a 3 times more likely risk of falling. And that risk of falls actually increases with each 10 dB increase in hearing loss. So it's also something that we need to keep in mind, as we know falling contributes to embarrassment and hip fractures and all these things with our older adults. Something that's not talked about too frequently are the economic costs of hearing loss. There are some studies that show untreated hearing loss can decrease annual income by as much as $30,000. And the unemployment rates for untreated severe hearing loss are double that of individuals with normal hearing or treated hearing loss. So there's also this societal cost because of the underemployment of people with hearing loss. We also know that hearing loss is related to, as we age, hearing loss and dementia are more common because they're linked, right? There are few proposed mechanistic pathways linking hearing loss and cognitive function. So to put it in simplistic terms, the peripheral auditory system encodes a signal and sends it to the brain for processing. And when that signal is fragmented because of a significant hearing loss, that may require the brain to recruit other brain areas to process that sound, and that could be at the detriment of other higher function processes like working memory. Additionally, there have been MRI studies to show that with increased rates of hearing loss, there's actually increased rates of brain volume loss, so contributing to overall brain aging. And then very intuitively to all of us as healthcare professionals, hearing loss is associated with social isolation, and social isolation is a strong predictor of cognitive decline for our patients. So there are many studies showing this link between age-related hearing loss and dementia. This particular study I wanted to talk about today because they looked at this relationship over a period of 10 years, and they had a huge sample. They had a huge database of patients to pull information from. And unsurprisingly, incidence of dementia was significantly higher among those with age-related hearing loss. But some of the conclusions from this study were really interesting. In particular, age-related hearing loss preceded the onset of clinical dementia by 5 to 10 years, making it a possible non-invasive biomarker for cognitive decline, and probably one of the largest modifiable risk factors for cognitive decline, because we just really need to give these patients access. So what are the benefits of giving these patients access or treating hearing loss? So the risk of falls decreases, actually. There have been studies, actually, of cochlear implant recipients where they were wearing these inertial sensors that while standing in the dark for 30 seconds with their cochlear implants on, and then with them off, and they found that there was greater stability with the cochlear implants on. Also, when the cochlear implant was accompanied by music or sound input, that risk of falls further declined. And again, we know risk of falls increases the risk of hip fracture and anxiety, embarrassment for these older adults, but hearing can actually positively affect that. There have been a lot of studies also to show the long-term impacts of cochlear implants on various measures like cognition, speech perception and noise, and just overall quality of life measures. So this particular study looked at these 3 measures over a pretty good period of time, and they found significant benefits at 6 months to a year post-cochlear implantation, and these results remained stable even at 7 years post. But what was pretty interesting was that pre-cochlear implant testing showed that about 45% of the patients in the study had a mild cognitive, was that me? had a mild cognitive impairment before they got their cochlear implant. And of that group, 32% of them returned to normal cognition at 7 years post-cochlear implantation. And what's also pretty interesting is that while 54% of them had normal cognition pre-implant, none of them had 0% developed dementia at 7 years post-cochlear implantation. So this is showing this link between having the correct amount of auditory access and cognitive health. And it also tells me that, or tells all of us that even individuals with a mild cognitive impairment should be considered for a cochlear implant. We shouldn't just decide that they couldn't benefit from this treatment because of any kind of cognitive decline. And also that hearing rehabilitation has a positive effect on neurocognitive functioning. This study is really exciting because it was actually the first of its kind to show neurocognitive benefit from using hearing aids. And I know we were just discussing hearing aids a little bit. So this cross-modal reorganization is a form of cortical compensation observed in deafness and even with lesser degrees of hearing loss. So the auditory cortex actually gets repurposed by intact visual and somatosensory modalities. So this study investigated if clinical treatment with hearing aids could actually modify neurocognitive outcomes. And the study used high-density EEG to record responses to visually evoked potentials. They assessed cognitive function, and then they did this speech perception in quiet and in noise. And they looked at 28 adults with untreated mild to moderate age-related hearing loss. They had age-matched normal hearing peers, and then they assessed this group with age-related hearing loss at baseline, and then 6 months after proper hearing aid use. And I know we were talking a little bit about hearing aids before, so I just wanted to add some of the fitting protocols that go into, properly fit hearing aids makes a big difference. Ensuring physical fit, when these patients see an audiologist for a significant hearing loss, they need to make sure that the hearing aids are fit appropriately, that they're verified, and that they help orient the patient to how they work. And then, of course, talking about this auditory rehabilitation and acclimatization. And when I say verification, this is what it looks like in an audiology office, or this is a equipment called real ear measurements, or verification of the hearing aids, where they actually put a little probe in the ear with the hearing aid to measure the output of the hearing aid to make sure it meets prescriptive formula. They use a prescriptive formula to make sure it meets those targets to ensure proper audibility. So in this study, they ensured properly fit hearing aids, and these hearing aid users were good users that wore them all day, every day. They were not compensated, but they were compensated by the study, but so maybe that improved their hearing aid use. At baseline, before the hearing aid trial, the brain, this shows that the first column A, these are the normal hearing peers. And column B shows that the brain is recruiting and repurposing the auditory cortex for other brain functions. So this is before the hearing aid trial. And then following the 6-month hearing aid trial, there was an actual reversal in cross-modal reorganization of the auditory cortex. And this actually reflected more normal organization of the cortex that was very similar to the normal hearing subjects at baseline. So this is exciting because this is actual evidence to show that treating hearing loss can lead to neuroplastic changes in the brain and have cognitive benefits, and even have this reversal in effect. Treating hearing loss with hearing aids or cochlear implants, clearly, we've demonstrated, really helps patients. Better sound signal reduces the cognitive load, reduces the listening effort and fatigue. It stimulates the brain to prevent volume changes. Some studies have even shown that even with 3 weeks worth of hearing aid use, patients perceived a dramatic reduction in their psychosocial handicap. And then there's these economic benefits that are really not spoken about much. So people ask us a lot, what's better, hearing aids or cochlear implants? And for adults who are cochlear implant candidates, cochlear implantation is better than hearing aids. They've done studies regarding speech perception measures, educational opportunities, employment opportunities, quality of life measures for patients who are candidates for a cochlear implant. And not everyone is, obviously. So for those patients who are candidates, cochlear implants always outperform hearing aid use. And cochlear implants are cost effective. For the patient in particular, they might be going through several sets of hearing aids, and hearing aids are basically amplifying sound to an already damaged hearing system. So there's a narrow dynamic range, meaning the difference between what they hear soft and what they hear loud is very narrow, and it makes it, there's this high amount of recruitment, meaning what that's barely audible is very close to what's uncomfortably loud. So they're cost effective also for you and for the healthcare providers, because having proper amplification can reduce depression, isolation, all these other health risks that we talked about earlier. The problem with cochlear implants, like Dr. Volker mentioned, is that adoption is low, even though we've gone a long way from these vintage cochlear implants that were very large and had to be worn on the body to these off-the-ear, very sophisticated, Bluetooth-compatible processors. The penetration of cochlear implants is really only 5 to 8%. What else is important? Of course, compensatory strategies and rehabilitation is very important for these patients. Lip reading, using good good visual cues, of course, good communication strategies. In terms of, auditory rehabilitative strategies, Dr. Volker talked about audiobooks, which is great, and we always recommend that. Also, TED Talks are fun, because nowadays you can find a TED Talk on anything that interests you, and they have real-time closed captioning without the delays that our TVs have. So they can really strengthen those neural pathways between the words that they're seeing and what they're hearing through their technology. Other types of things to make life easier for your patients. CapTel phones aren't readily given to patients for some reason, but they are free from the state of California. You just need a professional to authorize them. So I do this with basically every patient that I see for a cochlear implant. So they're just free phones that will transcribe everything that's being said, even voicemails. They get really excited about the voicemail part. Remote microphone technology is used all the time for children and not used very much for adults, but it really helps hear and background noise, and they're accessible from hearing aids and cochlear implants. So there's a lot more that we can do. There's transcription apps like Ava. And then also empowering your patients to use self-advocacy is really important. Helping them with these resources to know about their hearing loss, let people know, research the accommodations that are appropriate for them in the workplace, understanding where to position themselves in a restaurant, for instance, instead of sitting in the middle of the restaurant where noise is all around them, sitting with their back like in a booth to the wall so that the noise is directed in only one direction. Support groups are always helpful. And then full-time use of technology is really important. And unfortunately, a lot of patients don't realize this, but your brain needs to acclimate to hearing more sound, especially if there's been a longer duration of deafness. So full-time use is always associated with better outcomes for hearing aids and cochlear implants. So obviously, hearing loss, we've demonstrated is very highly prevalent. Untreated hearing loss has a lot of health risks associated with it. And we know now that hearing loss is a modifiable risk factor for dementia and cognitive decline. And we can maybe even reverse some of these effects of cognitive decline with appropriately fit amplification, hearing aids, and cochlear implants. Just encouraging patients to use technology, access auditory rehabilitation, and just practice these self-advocacy techniques can really help individuals. We've seen pretty miraculous changes in quality of life and with many of our patients. So our cochlear implant program email is live now. So if you have referrals or patients that you need seen, you can send it here. That's our clinic phone number, and that's my personal email address. If you have questions or just want to run ideas past us about some of your patients that you're struggling with, we're happy to help you. Any questions?
I think there's one question.
Hey, I was fascinated by the idea that playing music in the ear helps you from falling.
I think having the spatial or having the auditory access also improves your spatial awareness. So just by wearing them improved their balance, but also by having that auditory input that further improved their balance because they could sort of assess their body in space. Yeah.
Pretty
But
incredible.
it's pretty nice, yeah.
Thank you, Becky. That was fantastic.